The journey of pregnancy begins long before a positive test result. For many, it starts with a subtle shift, a whisper from the body, an unexplainable feeling that something profound is underway. Recognizing these early signs requires a blend of intuition, self-awareness, and a willingness to listen closely to the messages your body sends. In this comprehensive guide, we'll explore the earliest signs of pregnancy, delve into the science behind each symptom, share real-life stories, and offer practical advice for those wondering if they might be experiencing the very first moments of new life. It often starts with a feeling, an inexplicable sense that something is different. Perhaps you wake up one morning and find that your cherished cup of coffee, the one you've enjoyed every day for years, suddenly smells offensive or tastes strange. Or maybe, despite a restful night's sleep, you find yourself dragging through the day, fighting a level of fatigue that feels deeper than anything you've ever known. Sometimes, it's as subtle as a favorite scent turning sour, or a sudden wave of emotion washing over you for no apparent reason. These early whispers are your body's way of announcing a monumental change. Before we dive into the specifics, it's important to understand that every body is unique. Some people experience a cascade of symptoms almost immediately, while others notice only the faintest hints until much later. Still, there are patterns, common threads that many women share in those first few weeks after conception. Let's explore these early signs, starting with the most frequently reported experiences. Extreme fatigue is often the first and most overwhelming symptom. This isn't just ordinary tiredness, it's a profound exhaustion that permeates every muscle and bone. Why does this happen? In the earliest days of pregnancy, your body is working overtime. It's producing higher levels of the hormone progesterone, which helps maintain the uterine lining and supports the developing embryo. At the same time, your metabolism is ramping up, and more energy is being diverted to support the new life growing inside you. The result is a level of fatigue that can make even simple tasks feel monumental. If you find yourself needing extra naps or struggling to stay awake during the day, don't dismiss it as just a busy week. Your body may be signaling something significant. Changes in the breasts are another hallmark of early pregnancy. Many women notice that their breasts feel different, more sensitive, sore, or even tingly. The areolas, the area around the nipples, may darken and become more pronounced. Some women also observe that the veins on their breasts become more visible, creating a delicate roadmap just beneath the skin. These changes are driven by hormonal shifts as your body prepares for the possibility of breastfeeding. Even before you know you're pregnant, your body is already getting ready for the next stage. Nausea, often called morning sickness, is perhaps the most famous early sign of pregnancy. But the name is misleading. Nausea can strike at any time of day or night, and for some, it's a constant companion. This symptom usually begins around the second or third week after conception, but it can start even earlier for some. The intensity varies widely. For some, it's a mild queasiness, while for others, it can be severe enough to interfere with daily life. The exact cause isn't fully understood, but it's believed to be related to rising levels of human chorionic gonadotropin, HCG, and estrogen. If you find yourself turning green at the smell of certain foods or feeling nauseated for no clear reason, it could be an early clue. Beyond these classic symptoms, there are subtler signs that often go unnoticed or are mistaken for other conditions. A heightened sense of smell is one such example. Suddenly, familiar scents become overpowering. Your partner's cologne, the aroma of garlic in your dinner, or even the smell of your own shampoo can become too much to bear. This heightened sensitivity is thought to be an evolutionary adaptation, helping pregnant women avoid foods or substances that could be harmful to the developing baby. Food aversions and cravings are another telltale sign. Foods you once loved may now seem unappetizing or even repulsive. Conversely, you might find yourself craving unusual combinations, pickles with ice cream or peanut butter on everything. These changes in taste are driven by hormonal fluctuations and are as unique as the individual experiencing them. Mood swings are a less talked about but equally common early symptom. One moment you might be laughing at a joke, and the next, tears are streaming down your face over a touching commercial or a cute animal video. The surge of estrogen and progesterone affects neurotransmitters in the brain, leading to emotional highs and lows that can feel bewildering. If you find yourself riding an emotional roller coaster, know that it's a normal part of early pregnancy. Some signs are so subtle, even healthcare providers admit they can be easy to overlook. Light spotting, known as implantation bleeding, occurs when the fertilized egg attaches to the uterine wall. This typically happens 6 to 12 days after conception and may present as a small amount of pink or brown discharge. It's often mistaken for the start of a period, but it's usually lighter and shorter in duration. Mild cramping can also occur as the uterus begins to expand and make room for the growing embryo. These cramps are similar to those experienced before a period, but they're usually less intense and don't lead to menstruation. If you notice cramping without the arrival of your period, it could be an early sign of pregnancy. Frequent urination is another early clue. Even in the first few weeks, the kidneys begin to process more fluid as blood volume increases to support the developing fetus. This means more trips to the bathroom, sometimes even before you've missed a period. While these physical signs are important, many women report a deeper, more intuitive sense that something is different. Real-life stories highlight the power of intuition. One woman describes vivid dreams about babies, another finds herself crying at commercials, and yet another is suddenly repulsed by her favorite chocolate. These anecdotes underscore the idea that the body often knows before the mind does. If you find yourself experiencing several of these symptoms, it's natural to feel a mix of emotions: hope, anxiety, excitement, and even disbelief. The next steps are crucial. Start by tracking your symptoms in a journal, noting when they occur and how intense they are. This record can be invaluable when discussing your symptoms with a healthcare provider. When it comes to testing, patience is key. Home pregnancy tests are most accurate a few days after a missed period, when HCG levels are high enough to be detected in urine. Testing too early can lead to false negatives, causing unnecessary confusion and stress. If you're eager for answers, a blood test at your doctor's office can detect pregnancy even earlier, as it measures lower levels of HCG. Understanding the timeline of early pregnancy symptoms can also provide clarity. In the first week or two, you may notice fatigue and mood changes as your body gears up for ovulation and potential conception. Around the third week, implantation bleeding and mild cramping may occur. By the fourth week, breast changes, nausea, and a heightened sense of smell become more common. The fifth week often brings a missed period and intensifying symptoms, while the sixth week is when morning sickness typically peaks and emotional shifts become more pronounced. It's important to remember that pregnancy is measured from the first day of your last menstrual period, not the day of conception. This means you can technically be considered 2 weeks pregnant before the egg is even fertilized. This method of calculation can be confusing, but it's the standard used by healthcare providers to estimate due dates. As you navigate these early days, trust your body. The earliest signs of pregnancy are not always obvious or textbook. You may experience all the classic symptoms, just a few or none at all. Sometimes it's a powerful hunch, a sixth sense that something is different. The key is to tune in and listen to what your body is telling you. If you suspect you might be pregnant, share your feelings and experiences with a trusted friend, partner, or healthcare provider. The journey can be emotional and sometimes overwhelming, but you are not alone. Countless women have walked this path before you, each with their own unique story. For those trying to conceive, these early signs can bring a mix of hope and anxiety. It's natural to analyze every twinge and symptom, wondering if this could be the month. If you're not trying to conceive, the possibility of pregnancy may bring a different set of emotions: uncertainty, fear, or even excitement. Whatever your circumstances, knowledge is empowering. Let's take a closer look at the science behind these early symptoms. After fertilization, the embryo travels down the fallopian tube and implants itself into the uterine lining. This process triggers a cascade of hormonal changes, including increased levels of HCG, estrogen, and progesterone. These hormones are responsible for many of the physical and emotional changes experienced in early pregnancy. Progesterone, often called the pregnancy hormone, plays a crucial role in maintaining the uterine lining and supporting the developing embryo. It also has a sedative effect, contributing to the profound fatigue many women feel. Estrogen supports the growth of the uterus and breasts, while HCG signals the body to stop menstruating and supports the production of other pregnancy hormones. As the body adapts to these changes, it sends out a variety of signals. Some are obvious, like a missed period or morning sickness. Others are more subtle, like changes in taste, smell, or mood. Each symptom is a sign that your body is working hard to support new life. It's also important to recognize that not every symptom is unique to pregnancy. Many early signs, fatigue, mood swings, cramping, can also occur with PMS or other conditions. This overlap can make it challenging to know for sure if you're pregnant without testing. That's why tracking your symptoms and being mindful of patterns can be so helpful. For some women, early pregnancy is marked by a sense of calm or clarity. They report feeling more in tune with their bodies, noticing changes that might have gone unnoticed in the past. Others experience anxiety or uncertainty, especially if they've been trying to conceive for a long time or have experienced pregnancy loss in the past. Whatever your experience, it's valid. As you wait for confirmation, focus on self-care. Get plenty of rest, eat nourishing foods, and stay hydrated. Avoid substances that could be harmful to a developing baby, such as alcohol, tobacco, and certain medications. If you have questions about what's safe, consult your healthcare provider. If you receive a positive test result, schedule an appointment with your doctor to confirm the pregnancy and begin prenatal care. Early prenatal visits are important for monitoring your health and the health of your baby. Your provider can answer questions, address concerns, and help you prepare for the months ahead. For those who receive a negative test result but still suspect pregnancy, wait a few days and test again. Sometimes HCG levels are not yet high enough to be detected. If your period does not arrive within a week or two, follow up with your healthcare provider. The early days of pregnancy are a time of transformation, both physically and emotionally. Your body is working hard to create the conditions for new life, and every symptom is a testament to that incredible process. Whether you're experiencing fatigue, nausea, mood swings, or just a powerful hunch, trust yourself. Your body knows before you do. If you're supporting someone who may be pregnant, offer empathy and understanding. The early weeks can be filled with uncertainty and a wide range of emotions. Listening without judgment and providing practical support, like helping with chores or offering a listening ear, can make a big difference. For those who love learning about how life begins, the science of early pregnancy is endlessly fascinating. From the moment of conception, a complex series of events unfolds, guided by hormones and influenced by genetics, environment, and chance. The body adapts in remarkable ways, preparing for the possibility of nurturing a new life. In summary, the earliest signs of pregnancy are a blend of physical symptoms, emotional shifts, and intuitive feelings. Fatigue, breast changes, nausea, heightened senses, food aversions, mood swings, spotting, cramping, and frequent urination are all potential clues. But every experience is unique, and not everyone will have the same symptoms. If you suspect you might be pregnant, take time to listen to your body, track your symptoms, and seek confirmation through testing and medical care. Trust yourself and your intuition. After all, your body often knows before you do. Share this information with anyone who might benefit. Whether they're trying to conceive, suspect something is different, or are simply curious about the early stages of pregnancy, this knowledge can be empowering. Every journey begins with a whisper, and for many, that whisper is the first sign of something truly life-changing. As you move forward, remember that you are not alone. Countless others have walked this path, each with their own unique story. Listen to your body, trust your instincts, and seek support when you need it. The journey of pregnancy is one of the most profound experiences life has to offer, and it begins with the smallest of signs, a flutter, a feeling, a whisper from within. Let's take a deeper look at each of these early signs, exploring the science, the stories, and the strategies for coping with uncertainty. Extreme fatigue is not just a matter of feeling sleepy. It's a bone-deep exhaustion that can make even the simplest tasks feel overwhelming. This fatigue is caused by a combination of factors: rising progesterone levels, increased blood production, and the energy demands of early fetal development. Your body is working overtime, even if you can't see it. If you find yourself needing to nap more often or struggling to get through the day, give yourself permission to rest. Your body is telling you it needs extra care. Breast changes are among the earliest physical signs of pregnancy. Hormonal shifts cause the breasts to become more sensitive, swollen, or tingly. The areolas may darken, and veins may become more visible. These changes are your body's way of preparing for breastfeeding, even in the earliest days. If you notice these symptoms, consider wearing a supportive bra and avoiding underwires that can cause discomfort. Nausea or morning sickness can be mild or severe. For some, it's a slight queasiness. For others, it's persistent and debilitating. Eating small, frequent meals and avoiding triggers like strong smells or certain foods can help. Ginger tea, crackers, and bland foods are often recommended. If nausea is severe and you can't keep food or liquids down, contact your healthcare provider. A heightened sense of smell can make everyday experiences overwhelming. Scents that once went unnoticed may now be overpowering. This sensitivity is believed to help protect the developing fetus by making you more aware of potential toxins or spoiled foods. If certain smells are bothersome, try to avoid them when possible and keep your environment well ventilated. Food aversions and cravings can be surprising and sometimes amusing. You might suddenly dislike foods you once loved or crave unusual combinations. These changes are driven by hormonal shifts and can vary from day to day. Listen to your body and try to eat a balanced diet, but don't be afraid to indulge reasonable cravings. Mood swings are common and can be intense. The emotional ups and downs are a normal response to hormonal fluctuations. If you find yourself feeling anxious, irritable, or weepy, know that you're not alone. Practice self-care, talk to supportive friends or family, and seek professional help if your mood becomes overwhelming. Spotting, or implantation bleeding, is a light discharge that occurs when the fertilized egg attaches to the uterine lining. It's usually lighter and shorter than a period and may be pink or brown in color. If you experience heavy bleeding or severe pain, contact your healthcare provider to rule out other causes. Cramping is another common early symptom. These cramps are usually mild and similar to those experienced before a period. They're caused by the uterus expanding to accommodate the growing embryo. If cramps are severe or accompanied by bleeding, seek medical advice. Frequent urination can start early in pregnancy, as the kidneys work harder to filter increased blood volume. This symptom may be inconvenient, but it's a normal part of the body's adaptation to pregnancy. Stay hydrated and try to use the bathroom regularly to avoid discomfort. As you navigate these early signs, remember that every experience is unique. Some women have all the classic symptoms, while others have only a few. Some know they're pregnant before a test confirms it, while others are surprised by the news. Trust your body and your intuition. If you're trying to conceive, the 2-week wait between ovulation and a missed period can be filled with anticipation and anxiety. Tracking your symptoms, using ovulation predictors, and maintaining a healthy lifestyle can help you feel more in control. But remember, stress can also affect your cycle, so try to be gentle with yourself. If you're not trying to conceive and suspect you might be pregnant, take time to process your emotions. Pregnancy can bring a range of feelings, from excitement to fear. Seek support from loved ones or a healthcare provider if you need guidance. The journey of early pregnancy is a time of transformation, both physically and emotionally. Your body is adapting to support new life, and every symptom is a sign of that incredible process. Listen to your body, trust your instincts, and seek support when you need it. As you move forward, remember that knowledge is power. Understanding the early signs of pregnancy can help you make informed decisions about your health and your future. Whether you're hoping for a positive result or not, being aware of your body's signals is an important part of self-care. Share this information with anyone who might benefit. Whether they're trying to conceive, suspect something is different, or are simply curious about the early stages of pregnancy, this knowledge can be empowering. Every journey begins with a whisper, and for many, that whisper is the first sign of something truly life-changing. The earliest signs of pregnancy are your body's way of communicating that something extraordinary is happening. Listen closely, trust yourself, and remember that you are not alone. The journey of pregnancy is one of the most profound experiences life has to offer, and it all begins with the smallest of signs, a flutter, a feeling, a whisper from within. As you reflect on these early signs and what they might mean for you, take comfort in the fact that your body is wise. It knows before you do, and it's guiding you every step of the way. Whether you're hoping for a new addition to your family, navigating uncertainty, or simply marveling at the miracle of life, remember that every journey starts with a whisper, a gentle nudge from within, inviting you to pay attention, to trust, and to embrace the possibilities ahead. So, could that tiny flutter in your body be the beginning of a brand new life? Only time will tell, but by tuning in, listening closely, and honoring the signals your body sends, you're already taking the first steps on an incredible journey. One that begins with a whisper and unfolds into a lifetime of love, growth, and discovery.